Hi, my name is Michelle Smith, and we're going to discuss medical terminology in this PowerPoint. A case study will be presented, and all terms will be used medically. The objective of this PowerPoint is to summarize a paramedic's report, discuss medical terminology, breaking down the 8 different systems, summarize the patient's overall condition, and discuss initial observation. Paramedic report. Male patient, date of birth July 1st, 1985, involved in an MVC, motor vehicle collision, and was an unrestrained driver. Patient's chief complaint, left lower quadrant pain, pain in left leg, arm, and head, denies LOC, loss of consciousness. Patient's blood pressure is currently 165/84, heart rate 108, respiratory rate 24, temp 96.8 on room air, SpO2, 98%. Patient's left arm and leg splinted. Integumentary system. The patient's integumentary system is not intact. Patient noted to have blood on head, which could be indicative of a laceration or abrasion. Gauze was placed at the scene. Patient noted to have an open fracture to left elbow. Musculoskeletal. Patient's musculoskeletal system is not intact. Patient complains of pain in left leg and arm. Left leg is splinted at scene and sling was placed on left arm. Possible fracture of the left leg, open fracture noted on the left elbow. Cardiovascular. Patient is currently tachycardic and hypertensive. Heart rate 108, blood pressure 165/84. Respiratory. Patient's SpO2 is 98% on room air. Patient is noted to be tachypneic with a respiratory rate of 24. Digestive. The patient is complaining of left lower quadrant abdominal pain with ecchymosis indicative of abdominal trauma and contusion. Patient will need CT scan to rule out abdominal trauma. Reproductive. The patient's reproductive system is intact. No apparent injuries noted. Patient offers no complaints at this time. Endocrine. BP is elevated to 165/84, hypertensive, heart rate 108, tachycardic. The endocrine system is releasing hormones which are increasing the patient's BP and heart rate at this time. Nervous system. The patient's automatic nervous system will react to the patient's internal environment due to the impact of the accident and the stress on the patient's body. Treatment and diagnostics. Intravenous access will be placed. Lab work such as a CBC, chemistry, blood type and screen, and finger stick will be performed. Computerized tomography scan, known as a CAT scan, trauma, rule out cerebral hemorrhage and abdominal trauma will be ordered. X-rays of the left arm and leg will be performed to rule out fractures. Cardiac monitoring will be done. Patient currently tachycardic and hypertensive. Pain medication will be offered. Patient noted to have open fracture of elbow. Ice will be applied to affected areas. Patient's past medical history. Patient is a known diabetic type 1 with a history of hypertension, hyperlipidemia, scoliosis, asthma, GERD, kidney stones, depression, and anxiety. Patient denies any known drug allergies. Initial observations. On exam, patient noted to have open fracture to left elbow, laceration to forehead 2 centimeters long with a hematoma, ecchymosis to left lower quadrant indicative of abdominal trauma, swollen left knee with ecchymosis. Overall condition of patient. Patient's overall condition is stable at this time. Patient is alert and oriented to person, place, time, and event. Vitals are currently stable. Patient will require surgery for open fracture. Pain management will be initiated. Blood products will be available. Thank you for listening to my presentation on the case study of a male involved in a motor vehicle collision. Thank you and have a wonderful day.